each of the group with a discussion, right or left. I have 1 minute to discuss with the whole group and then 1 minute. Don't take phone from him. I need one phone. Don't disturb. Otherwise, I will distribute you out. Cap. Cap, sir. Very good. Left. Good. No, join them. Come down and join them. Okay. Now please now listen. Please. Excuse me. Now listen. Hip bone is a large irregular bone. Before we determine what is right or what is left, many of the group they did well, right. Many of the group they could not, no problem. But now we are going to learn about how it looks like right or left, how to differentiate. Before I go to the differentiation, you must remember few parts of this bone. This flat upper part is ilium. This flat upper part. Some of the group they make it like this. No. Upper part is flat. Ilium. Then you have combination of three bones here. Ilium, here pubis, here ischium. Here ilium, pubis. This one is pubis and this one is ischium. Okay, forget even this. I will come to this again. Upper flat part. Try to make it upper flat part. Ilium. Number 1. Number 2. This foramen. Obturator foramen. Obturator foramen. Number 3. This big notch. Sciatic notch. Sciatic notch. Okay. Now, try to fit the sciatic notch in your hand. Where it fits good with acetabulum on the lateral side. This is the bone of the same hand. So right side, this is my right side bone, for example. Understand? Yes, right sided bone. Yes, left sided bone. Okay. Here, hello. Right sided bone. Huh? Left bone. Good. See this one. Hello. Yes. Right, left. Right, left.
لا يا هذه رايت.
Hello. Yes, right. Now you're
رايك يا غالي شلون رايك؟ عايز برا يصير
طيب امسك يا شيخ.
شلون هذا يصير كذا انت كليت كذا مع الجمره
امسك وين النوتش طيب؟
هذا النوتش
طيب شلون تمسك؟
هذا اهم
لو مسكت النساء
هذا شوف هذا وشو بيبس هذا وش ذا لو ايش يمسك هنا طيب خلينا نمسك كذا هذا اللي قاعد يصير شوف اسمع عارف اسمع تاخذ النوتش يصير اصابعك برا برا
okay. See it now again. So ilium, flat part on the upper part. Good. The obturator foramen down, and this acetabulum, which is going to make the joint, must be on the lateral side. Okay. Keeping this view as pelvic view inside,
Medial.
because the pelvic cavity inside. If I take the other bone,
left
pelvic cavity sort of structure inside, ilium
Ilium.
up, obturator foramen down, and this back, big tuberosity towards my side, and then I put the hand here. So this is the way you hold the hip bone in hands. Right bone, left bone. Understand?
Yes.
One hip bone is called hip bone. When two they unite, they call hip girdle.
Yeah.
And when I put between the two the sacrum, it makes a pelvis.
Okay.
Again, one hip bone, single hip bone. The other name I don't write innominate bone. The other name innominate bone. Forget. Remember hip bone. So one is hip bone. When we combine two, this is called hip girdle. And when I put sacrum at the place, now it is called pelvis. Okay, so remember these three terms. Then, now I will start here. Ilium superiorly, pubis and ischium. What are these bones? These are here. Ilium, this red one, pubis, this ischium. Where? Ilium, pubis, ischium. Good? Ilium, my hand in ilium now. Pubis, ischium. Good? Obturator foramen. Obturator foramen. Acetabulum. Acetabulum. Acetabulum, obturator foramen. I write everything, but just to memorize you here, I must do it. Okay? Acetabulum is the joint cavity. Acetabulum is actually the joint cavity. Sciatic notch is this one. I will come to this. Don't worry. Let's go in a sequence now. Now you know the position, side determination, right or left?
yes
Easy?
yes
No mushkil in exam?
no mission
Inshallah. This is the best way. Number one. Number two. Anatomical position. The anatomical position is not straight like this. It is curved and like this. This is the anatomical position. Try to fix. Even the whole of this pelvis is not just like it's staying here. It is like slightly elevated, depressed from the back side like this. Generally, we call this thing as pelvic inlet. True pelvis. This is again look like inlet. But we say this as false pelvis because this is not complete. So the ilium makes false pelvis, the other bones make true pelvis. Okay? Then, this is pelvic inlet or true pelvis. With me, Shiva?
Yes.
Pelvic outlet. This is pelvic outlet. This or this. Pelvic outlet. Now, we will start. You know the positions? Ilium, superiorly, flat part of the bone. So it is superiorly flat part of the bone. This is iliac crest. You can feel the iliac crest, whole of it like here. You can feel iliac crest. It has three borders. I am saying of ilium now. Three borders. Anterior border. When you hold the right in actual position, you will find anterior border, posterior border. If you hold it like this, you are confused like, okay? So, anterior border, posterior border, and this rough, this margin line, medial border. Again, anterior border, posterior border, medial border. Where is the crest? Here crest. Be with me. If you have questions, raise your hand. Here is the iliac crest. Clear now?
Yes.
Surfaces. Gluteal surface. Outer. Gluteal surface. Then, iliac surface. This small, smooth, inner iliac surface or iliac fossa. Then, sacropelvic surface. This rough part. Sacropelvic surface. Again. Anterior border, posterior border, medial border. The crest, iliac crest, go lateral side, outer side is gluteal surface, inner iliac fossa, and another surface, sacropelvic surface. It is very rough. You can feel on the bone.
Yeah.
It is very rough. So sacropelvic surface. Good, Shiva?
That's good.
Sacropelvic surface again divided in two parts. Can you appreciate this like an ear?
Yeah.
Okay? Looks like an ear, auricular surface. I will come to it again. But it is very good here to show you. Iliac crest. This is iliac crest. It has two lips. Inner lip, outer lip. Or medial lip, lateral lip. The highest point on this, if I keep this in anatomical position, the highest point here is actually corresponding to L3 and 4 vertebra. Follow, it will follow L3 and 4 vertebra. This is a landmark for lumbar puncture. So you can guess, have some idea. Again, iliac crest, medial lip, lateral lip, highest point. Anterior border, posterior border, medial border, gluteal surface, iliac fossa, sacropelvic surface.
Sir, about the borders.
Daqiqa. Clear now? Yes.
About the borders.
Borders, anterior border up till this.
Okay.
Posterior border up till this. Medial border up till this. I will have more pictures. Clear?
Yes.
Anterior border of ilium. From where? Anterior superior iliac spine. Anterior superior iliac spine to acetabulum. All this is anterior border. All this is anterior border. All this is anterior border. From, keep the bone in anatomical position and read. From anterior superior iliac spine to this depression, then another spine, anterior inferior iliac spine.
Okay.
And then it will lead to acetabulum. This is anterior border. The posterior border. Here, the posterior border, same like here we have anterior superior iliac spine, here we have posterior superior iliac spine. Here we have anterior inferior iliac spine, on the back we have anterior inferior iliac spine. After that there is a notch, sciatic notch, greater sciatic notch. Why? After this there is a spine, see here, greater sciatic notch. After this is the spine, and here another notch, lesser sciatic notch. So differentiate again. Very easy, quickly now. Anterior border,
Yes.
anterior superior iliac spine, anterior inferior iliac spine. Good? Posterior border, posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch, iliac spine, ischial spine, and lesser sciatic notch. Ischial spine, because this bone is ischium, so it is the spine of the ischium. Good.
Yeah.
Crest, medial lip, lateral lip, gluteal surface, iliac fossa, sacropelvic surface. Clear now? Good. Medial border. This is medial border. What are the things? From where? Iliac crest to iliopubic eminence. From iliac crest to this elevation here. If you feel the bones, there is an elevation. This elevation is called iliopubic eminence. So from here to here, iliopubic eminence. Here. From here to, if you feel the bone, this is an elevated part. This is called iliopubic eminence. So iliopubic eminence is this. From here to this is the bone. Separates the iliac surface from sacropelvic surface. Separates iliac fossa from sacropelvic surface. Good?
Yes.
Now, gluteal surface, outer, very easy. Gluteal surface.
Yeah.
Gluteal surface, if you very clearly see, usually not on the models, but on actual bones, you will find 3 lines. You can see in the picture, very clear 3 lines. One is called anterior gluteal line, posterior gluteal line, inferior gluteal line. Anterior, posterior, inferior gluteal lines. These are the lines for the attachment of gluteus maximus, medius and minimus with some description you know already. So, gluteal surface has 3 lines. Posterior gluteal line, anterior gluteal line, inferior gluteal line. On the models you may not be appreciating, but on actual bones they are very obvious. Like I take the picture. See here, 3 lines. This is the gluteal surface. Then, iliac fossa. This iliac fossa smooth. Iliac fossa is for the attachment of iliacus muscle. Iliacus muscle. Iliacus muscle is the flexor of my hip joint and yours always. Sacropelvic surface. Here, the rough one.
Yes.
The rough one is sacropelvic surface. It has iliac tuberosity. It has auricular surface. See, it looks like an ear. I make an ear close to it to make you remember. Auricular surface. See the picture. It looks like auricle. It looks like ear. Auricular surface, and after that here some pelvic surface. So again, iliac tuberosity, rough part. Then auricular surface, and then small pelvic surface. Good? Again, all of it. Quick revision. This is the way to find the bone. Hold the bone, right or left. Anterior border, posterior border, iliac crest, iliac fossa, gluteal surface. Good? Anterior superior iliac spine, anterior inferior iliac spine. Posterior superior iliac spine, posterior inferior iliac spine. Greater sciatic notch, ischial spine, lesser sciatic notch. Ischium, the front pubis. Clear now? Yeah. Yes. This is sacropelvic surface. Has 3 parts. Upper rough is tuberosity. So iliac tuberosity. The second one, like here, auricular surface. The third one here, smooth. Some very few area. This is pelvic surface. Pubis. Where is the pubis? See. This is ilium. This front is the pubis. This front bone is the pubis. It has 2 ramus, 2 attachments, one here, one here. So if I consider my this hand as pubis, so here is the body of the pubis. This body, this superior ramus, inferior ramus. What is ramus? See here, body, superior ramus joining with the other part of the bone. Inferior ramus joining with ischium. Again, pubis, body. This is body of the pubis now I'm holding. The body of the pubis. This ramus, superior. This ramus, inferior. It has two parts, two effects. It is attached to the bone and it also gives boundary to this fossa. Good? Obturator foramen. Not fossa, sorry. Okay, ramus, inferior ramus, I done. Body of the pubis, only this part, body, is flat. Okay? It has pubic crest, superior border here on the top, pubic crest. Then it has pubic tubercle, very important point. Where is the pubic tubercle? In front here. See this picture. All of you see the pictures. See, here is the pubic tubercle in green color in the pictures. And here is the pubic tubercle. On the pelvis, this is the pelvis, here is the pubic tubercle of this hip bone. Here is the pubic tubercle of this hip bone. What is the importance? Can you see this white line? This is inguinal ligament. This is attached to this pubic tubercle and anterior superior iliac spine like this.
What is this called?
Pubic inguinal ligament.
Ryan.
Inguinal ligament. Another inguinal ligament must be here. Good? Clear, Jawab?
Yeah.
Inguinal ligament. Yes. Happy? If you are happy, half of the class is happy. And if half of the class is happy, I am more than happy. Okay. Shabab, once again, please. Inguinal ligament here. What are the attachments? Anterior superior iliac spine, ila pubic tubercle. Anterior superior iliac spine, ila pubic tubercle. This is inguinal ligament of one side, another side. This is a very important ligament for making landmarks for the start of the thigh. And in the thigh, have you done thigh?
Yes.
Yes.
Femoral triangle.
Yes.
One of the boundary is inguinal ligament. Yes. Now clear?
Yes.
Good. Superior ramus of pubis. Superior ramus, this one. The superior ramus of pubis. The superior ramus of pubis. Pubic body to acetabulum. Connects the body to the acetabulum. Superior border, this one. Important name, pecten pubis. Pecten pubis. There are two important names here. In the previous slide, I show you pubic crest. This tip, this top is pubic crest. Then this all is pecten pubis. Remember only this. Enough. Remember, regarding pubis, you must remember many things. Body, pubic tubercle, pecten, and crest and pubic, pecten pubis. The line is pecten pubis. The elevation here is crest, the pubic crest. Then,
The superior ramus. It's another name for the pecten.
no, this all is ramus. There is one and superior border. The border is pecten. The border is pecten. All other borders are same, no use. But why I am saying this pecten pubis? Because when you will read the pelvic inlet, you will find this medial border, iliopubic eminence, pecten, and crest. So this is the sequence. In the pelvis, you will find the same line with prominence or eminence and then the border and then the crest. This is the anatomy. Inguinal ligament is attached here, pubic tubercle here, another pubic tubercle here. Both of them showing you pubic tubercle. Good? Understanding with me? I am repeating many times, I am going very slow. If you still find me fast, give me mukhalfa. Okay, inferior ramus of pubis. Body of pubis, superior ramus, inferior ramus. You find that this ischium also has a ramus. So this is a conjoined ramus for ischium and pubis. Sometimes called as conjoined ischiopubic ramus. How? See here. Ilium, pubis, ischium. See, body of the pubis, superior ramus. Body of the pubis, inferior ramus. And now ramus makes a connection with another ramus. This is the ramus of ischium. But combined collectively we call as ischiopubic ramus. Or some books say conjoined, yani united ischiopubic ramus, same, no problem. Again, here, can I do it like this? To show you. Ilium, pubis, ischium.
No.
The body of pubis has superior ramus, inferior ramus. The inferior ramus is again joining one ramus of the ischium. So this ramus combined, this combined is called ischiopubic ramus. Clear now?
Yes.
Good. Now we move to ischium. Where is ischium? This is ischium. Not only this bone, this is ischial tuberosity. There is an ischial spine. There is some part of the ischium here. So try to differentiate where is ischium. See here, tuberosity of the ischium, ramus of the ischium, and on the inner aspect you will find this whole is ischium. What it is making? See, greater sciatic notch, half of it made by ilium, half of it made by ischium. Greater sciatic notch, half made by ilium, the lower half made by ischium. See here, ilium, ischium. Then ischium has a tuberosity, then ischium has a ramus, one ramus of ischium, which is joined with the inferior ramus of pubis, making ischiopubic ramus. So what are the structures here in a sequence? On the posterior border, up till from tip, top to toe, you will find posterior, superior iliac spine, then a small depression, no name, then posterior, inferior iliac spine, then greater sciatic notch, ischial spine, lesser sciatic notch, ischial tuberosity. See here, posterior superior iliac spine, posterior inferior iliac spine, one here. Then, sorry, posterior here, posterior superior iliac spine, posterior inferior iliac spine, all greater sciatic notch, half by ilium, half by ischium. Then ischial spine, then lesser sciatic notch. Actually, during the lifetime, this foramen is covered with a membrane, obturator membrane. So it is not a foramen. But on X-rays, you will find, because the membrane is not visible on the X-ray, so it is labeled as foramen. Similarly, this notch, greater sciatic notch and lesser sciatic notch, they are actually covered with the ligaments, converting them into greater sciatic foramen, lesser sciatic foramen. For example, this is one ligament. My finger is one ligament. So here you can see now a foramen. So greater sciatic foramen. In the bone, you will find greater sciatic notch. Okay? So notch and foramen is the same until it is covered with the help of ligaments in the life. In the bones, you will find the notches. Ischial tuberosity. All of you who are sitting on their ischial tuberosities. Okay? Ischial tuberosity has different areas. Here. Here is, for example, ischial tuberosity. It has one line here and one line here. like this. Transverse line or ridge, oblique line or ridge. Why I am teaching these small things? Because when you see the scale tuberosity on printed bones, you will find a lot of red areas. So these are the attachment of muscles, origin of muscles. Which muscles? Here, in this upper part, hamstring and semimembranosus. In this, hamstring and semitendinosus, rather biceps and semitendinosus here. This is adductor magnus, and this is subcutaneous for the sitting. And here is the amount of fat which is holding the pelvic area here when a person is sitting on a surface. Think like this. Understand? Again. This is the ischial tuberosity. Ischial tuberosity has, if you appreciate very clearly, it has a transverse ridge and oblique ridge, dividing all these parts for the origin of muscles. Which muscles? Hamstring and semimembranosus, biceps and semitendinosus, adductor magnus mainly. And this white is left for the fat pad which is helpful in sitting posture. Clear? Ischiopubic ramus I told you. No problem. Obturator foramen. This. Obturator foramen. And I told you, in the life, this is covered with a membrane. Obturator membrane. What is the need if this is covered with? It must be a bone. The vessels, obturator vessels, which are cross the foramen like this. Okay? The obturator vessel. That is the reason it has a membrane. It has a small opening in the membrane, and the vessels can get out and come to the perineal area. Obturator vessels. Now, this is a large gap. It has very significant forensic importance. What? Here are two pelvis, one from male, one from female. Try to appreciate this foramen, obturator foramen. It is large and oval in males, and it looks more triangular in females. See all pictures. Can you just make light for 1 second? Full dark so that they can appreciate. Yes. Can you appreciate now? See male pelvis, this is the pelvic inlet. See female pelvis, inlet is broad. Another difference. The obturator foramen in males, oval and larger. In females, it looks like more triangular. Here is another difference. We will see with the pelvis when we will do the pelvis. Thank you. Lights. This is obturator foramen. Again, see here. Obturator foramen. The other way. The other way of light. Yes. Obturator foramen here. You can see now. Obturator foramen. If I say this pelvis,
oval and large.
Oval and large. If on the opposite hand we have a small and triangular sort of, another point is the pelvic inlet is very small, like here. So this is a male pelvis. Okay? Female pelvis has a very broad inlet, oval sort of. Acetabulum. This one. Acetabulum. All of this is acetabulum. How you find acetabulum? See, it is very deep. Still, there is a fibrocartilage rim like we have on the glenoid cavity.
No.
You remember glenoid cavity is very sathai, superficial. The head of humerus is big. So to make it more deep, Allah subhanahu wa ta'ala has given a fibrocartilage ring. Same type of ring is mojood here to make it more deep. Okay? The whole of the acetabulum is not articular. See, there is a C-shaped inner part which has hyaline cartilage, and only this is articular, making joint. The extra inner part is called fossa. The extra here, inner part is called fossa. Can you please switch off the light if visible? To all. Thank you. See here. Now clear. See here, this all is acetabulum. It has a rim, fibrocartilaginous to make it more deep. See, the C-shaped hyaline cartilage which will make the joint articulations with the head of the femur. See this empty space. This is called fossa, acetabular fossa. It is filled with fat to stabilize more the joint. Remember one thing, the fossa acetabulum is deficient here. To complete this, there is a ligament, transverse ligament, transverse acetabular ligament. All the things are written here, so you can read it wrong. Like, oh, it's good. It's good? Okay. Good for sleeping. See again, here is acetabulum, here is the articular surface. Why three colors of the acetabulum? Because ileum has contribution, pubis and ischium, they also make a contribution to make this acetabulum. This is femoral head, and you may be knowing that femoral head has a ligament. So from here it is attached. We will see when we will see the femur. Here is this circular is actually the rim, but here the fossa is deficient. So here is a ligament, transverse acetabular ligament, to make it more circular and stable. Common fractures and ossification. This is probably the bone in the body which ossifies from 8 ossification centers. 3 primary, 1 for ileum, ischium and pubis, and 5 secondary. I am not sure this is in your objective, so I make it very small. If you wish, read, otherwise shield. Here are the possible fractures. Trauma from the sides, making fracture of the ileum. Sometimes this is called iliac blade. Iliac blade fracture. Ileum. Fracture of the ileum. This is a very bad fracture when you fall from a height on your limbs and the
يا عبد الله ما كنا كويسين عبد الله